device is an integrative medical device from Ventros, My Ventros. And this device has 3-in-1 in the sense that it got acupuncture from the Chinese therapy, which has more than 5,000 years history, and has been proven to be very effective even in the Western medical world. The traditional medical world of the Western medicine, now they accept acupuncture as their complementary treatment. Now they can even have a brain surgery by not using a nitrous oxide gas to do anesthesia, but using acupuncture, whereby the patient is actually awake and not sedated totally. Like for example, they have open heart surgery just been shown to me about 2 days ago. The lady is awake, and they just use acupuncture to anesthetize her. So they did the bypass operation on her live, and she is awake throughout the whole operation. That shows how good is acupuncture. So the Western world has already accepted thoroughly this therapy by the Chinese, which has more than 5,000 years history. So you have no doubts about this therapy, acupuncture, which is highly effective in a lot of illnesses, especially for musculoskeletal problem. Means you got pain, you got numbness, you got nerve problem, you got muscular problem. It's very effective, right? So the other one will be the Magnetotherapy, which is a Japanese therapy. Actually, it has a few hundred years history, and it has been proven to be very effective. In fact, in Japan, if you go to Japan, you can see a lot of plaster where you have a small tiny piece of magnet inside, and you're supposed to place the plaster on the place where you have the pain, and it will take off the pain at that point, even for headache, for toothache, or whatever. It's like our Chinese koyo, but it is additional with a tiny piece of magnet. So this is Japanese magnetotherapy. Then it comes the Western therapy, which is using low level light therapy, which is the laser therapy. And this laser therapy is specific in the sense that it only uses 680 nanometer wavelength, which you can see it as a red light, but it's below the 700 nanometer, which is actually considered to be in the infrared area, which can give out heat. Whereas this one below 700 nanometer wavelength is considered cold laser therapy, meaning to say when you use this therapy, it does not emit any heat to the body or the surrounding, so it is safe. So this low light therapy is been used for in the US since early 2000, and has been approved by FDA as one of the therapy used by physiotherapists and in the physiotherapy department. And a lot of these chiropractors, they use it too. So this is used to treat, especially those days, big machine is for pain, aches, and what they call muscular neural problem. These are you normally use as a big machine. It costs probably $60,000-$70,000, which you can also see in the physiotherapy room in the hospital. These are big machines which you cannot be carrying it around. So this is the 3-in-1 device classified under class 3B medical device, meaning to say that this is a home-based device which you can use it and take it along everywhere you go. This is only 3-in-1 device in the world that has been approved by the Ministry of Health Malaysia, and it has won in the international exhibition in 2019 April, where in this international exhibition for latest invention under the health category, it won the second prize, the silver prize. Can you imagine to be in the international exhibition for world invention and to be able to win the second prize? This is a fantastic device. In order to win that, they must excel in the device capability, efficacy, and the effectiveness of the device to be able to be chosen as the silver medalist. Before they even go for this exhibition, they are sent through for testing and getting the certification for many renowned organizations like at this MAT certificate, which issue them ISO certificate, which is very, very hard to get for any medical devices in the world. If you want to get this device, you must send through a lot of clinical trials and a lot of papers to show the efficacy, the effectiveness, the side effect, if there's any, and whatever is necessary as medically required by the board to be able to be approved to get this ISO certificate. And this device has won this certificate. So this is to make sure that this device is very safe for use, and it is proven to be as good as it is supposed to be, as it claims to be, means the consistency of using the laser light at 680 nanometer, the consistency of using it is very important. If it is not in the consistent 680 nanometers wavelength, then you may not be able to get the efficacy and the effect that you require from the low light laser therapy. So this is ensure that also at the same time, this certificate is to prove the durability of the product. That means to say they have tested something like 10, 20,000 working hours of this device, and after that it's still working. It's just like a Rolex watch getting the chronometer certificate from Switzerland to prove that this is effective and accurate. So in this sense, it is proof to you that this product, the IM laser, is proven to be effective and durable for its lifespan of 10,000 hours as we are giving you, and 1 year warranty. If it's any defect, you can get it changed, a new one completely from the company if it's a manufacturing defect. But of course, if you happen to drop it and you lose it or whatever due to your own negligence, sorry, you got to buy a new one. Okay, so this is also certified by this. I don't read Chinese. This is from China, I believe. It's something like all these are Chinese certificates. So from the Chinese Academy of Science or medical bodies that approve that this device is good. Sorry, I don't read Chinese. So okay, next one. The Malaysian Ministry of Health has given approval for this device as Class 3B device, and this certificate is to prove that it's proven and approved by the Ministry of Health. Because if it is not proven, you are not supposed to sell this device in Malaysia. If you are caught, you can be fined 50,000. Yeah. So now you got the approved device to sell, so you don't have to worry, right? And you have the CARE certificate is also to prove that this device has been proven to be effective. So for the local Malaysian market, you have no worries. This certificate will put you in good place to prove to your customers that they are not buying a Me Too product or a product that is not endorsed and approved by the Ministry of Health. Okay, next please. You? Yeah, okay. Now, whatever it is, as far as I'm concerned, I'm a pharmacist by profession, and I'm a very ethical pharmacist in that sense. Now, whatever you do, irrespective of what you eat, what you apply, what you use, and what are you going to use, make sure that whatever you do, it does not cause any harm to your body, or does not cause any more harm than what you are having now. Like for example, if you are having hypertension, you have diabetic, somebody give you something, some herbs to try, and then says, okay, I would like to try because this guy says it's very good and all that. Do not try the product until you are very, very sure that it's not going to cause you more harm than good, in the sense that the device or the medical the herbs that is given to you will cause you more harm, in the sense that will it cure your diabetes or will it damage your kidney at the end of the day, or you will probably cause you a stroke instead of prevent you from getting a heart attack and stroke. So that is very important. Research the product thoroughly before you use it. So in this case of IM Ventros, there are 1.7 million sites for you to look into low light laser therapy to prove its efficacy and its safetiness in operation to use for us in 680 nanometers wavelength. And the efficacy is all there. You can even check for whatever diseases that you want. there's no fear to look at it. I have done this for about 3 days and 3 nights before I decided to accept this product and try to use it for my son and myself and start selling it. Now, this IM laser, as I says, the magnetism is already a few hundred years. Japanese Magnetotherapy, the acupuncture is more than 5,000 over years history, so you don't have to worry. Now, the laser light therapy has been in the market for probably a few decades. So it has been approved by FDA, has been used by NASA. And NASA usually uses the best of technology for their astronauts. And why they use it, I'll tell you. Okay, now let's start with what is this laser, what it does to us, right? Now, the low light laser therapy will, when you use it on the wrist, on the left, there are four lights at the back of the watch, which emits the laser light at 680 nanometer, is pointing onto your pulse area on the artery. So when the blood flows through, the laser light will strike on the mitochondria of the cells and stimulate the cells to produce ATP. That's the first one. It is stimulated to produce by striking on the mitochondria and the enzyme that created ATP, adenosine triphosphate. So this is the first one that is excreted by the mitochondria. The cell's energy and the cell capability and is a life of the cells, means the length of the life of the cells will be attributed to the number of ATP that it carries, and its efficacy is also due to the number of ATPs in the cells itself. So when the laser strikes on the cells of the mitochondria, because of the photon that is created in the laser energy, striking on the enzyme that creates ATP. This adenosine triphosphate will make the cell energetic and alive. So, as I says, the cells have something like our lifespan for a human being were like 125 years old. But unfortunately, not every one of us will live up to 125 years old. A lot of people died off because of certain illness and maybe some tragic accidents. But if you, according to the theories that we have, the cells in the human body, the number of cells created in the human body will be able to live up to 125 years old. So with the ATP increase in the cells, your body will be energized and you will feel very energetic. You won't feel tired, and you will be able to repair all the nerves, the muscles, and wherever problems that they have in the body, even to your whatever cells that they have, because we are talking about cellular level. We are not talking about specific organs. We are talking about cellular level in the sense that we are treating the whole body, red blood cells and whatever cells that pass through the blood system. So all these cells will be stimulated by the laser. So it will go through the whole body, even to your hair, the hair roots, to stimulate the production of hair or to grow new hair. So we are talking the whole body system as an organism, right? So the ATP is a fantastic thing. The more ATP you have in the body, you will be more energized, you'll be younger in your outlook, you'll be getting off you'll be able to bring down your diabetic condition because it will improve metabolism rate. So your body will be able to utilize the blood sugar more efficiently. And due to the blood circulation, the exuding of the blood sugar from the body through your skin and your kidneys will be more effective. So your blood sugar will be very well controlled because of the number of ATP in your body. And at the same time, the blood circulation helps. So the next one, it comes to nitric oxide. Now, mind you, do not confuse this with nitrous oxide. Nitric oxide, right? Not nitrous oxide. Nitrous oxide is a laughing gas that you use by the anesthesiologist to put you into sleep for the operation. This is nitric oxide, okay? Don't be mistaken for that. You say, oh, this is very good. You take nitrous oxide, you'll be dead soon. Huh? So don't do that, okay? So what this nitric oxide is secreted by the striking of the laser light onto our epithelial cells of the blood vessel. Like this nitric oxide will be a very good vasodilator. like it makes sure that they expand our blood vessel. So when the blood vessel is relaxed and expand and becomes softer, our blood pressure will come down. So this will be very, very effective for people who got hypertension. Now, you're using this IM laser, this IM device within a week or so. You monitor your blood level, your blood pressure regularly and daily. You see there is a drop. Because of this nitric oxide being excreted, you'll be able to open up the blood vessel. So this is the main one. The second one is because this nitric oxide also helps to prevent the oxidation of LDL. There's a low density lipocytes of the cholesterol that prevent is a good cholesterol to prevent the accumulation of atherosclerotic plaques in your blood vessel. That is very important. That's why when we grow old, a lot of people get plaque formed in the blood vessel in the heart. So you get heart attack. You got to go for bypass. You got to go for angioplasty. It's because of this. So it prevents the plaque formation in the blood vessel. And at the same time, with nitric oxide that excreted into the body, it also helps for men to get his erection because of the blood flow improve. So it will help the men in their ED, erectile dysfunction. You get a better erection than without using it. So this is fantastic for men, especially who are aged above 50 years old. They will encounter ED, which is very common in my practice. I sell a lot of Viagra and Cialis. So it's common to me. Is as a medical person, it's a normal thing, especially people who got diabetes. That's even worse. Is 100% they will have ED. And those people who are having hypertension, they will be taking medication to bring down their blood pressure. So they will also have ED. So these are the main problems of people who are aging. They will face all these problems. Another thing that nitric oxide will help is for athletes and people like us to increase our respiratory rate. Means to say, when we exercise, we will feel better in the sense that the transfusion of gas between the lungs and the blood will be far better. So we'll be more energetic, right? So this is the thing that you can see. So this is the effect of nitric oxide. The one that it also reduces the platelet stickiness in the sense that when we are aged, all of our platelets, all our blood will show the platelet agglutinating together in a stream, in the strip, or all together in the lump. These are the ones that will cause you numbness in the hand, extremities, stroke, dementia, Alzheimer, and heart attack. So by reducing the stickiness, that means breaking out all the platelets into individual cells, then you will prevent heart attack, strokes, and numbness in the body. Now, the next one is reduces. Now, it also improves the immunity system in the body by bringing up the monocytes and stickiness of the monocytes and the leukocytes, that the the phagocytes that also takes out and eat the bacteria or viruses that attacks our body. It will improve our immunity system. Now, it also reduces the multiplication of what they I cannot see this. Yo, can you move up? So it also okay. Okay. So and the next one is the production of reactive oxygen species. Now, it will help to stimulate the production of oxygen by being carried by the erythrocytes, the red blood cells, to all parts of the body because it if the blood vessels are all blood capacitors are all linked together, then the capacity of carrying oxygen on the cells will be very less. So if it is split up into individual cells, which can be proven by a live blood test, when you use the IM laser, before you use, you can do the live blood test. You can see your bloods are all clotted up together in strip, in strings, or in lumps. But after using IM laser for half an hour, you can see all your blood are split up and they're individualized. So because of that, because of the splitting out of the blood capacitors to individual cells, the surface tension, the surface area increases, so you can carry oxygen to all parts of the body more efficiently. And it also increases the blood circulation because of this. It's easy to flow. There is no traffic jam anywhere in the blood vessel. So your body will be able to get a better circulation. Right. The next one that it really stimulates is the production of stem cells. With this photon going to all the cells in various organs in the body, it will be able to reactivate the individual organ to secrete its own new stem cells. So these stem cells that is created by the individual organs will be able to repair the old cells that they are dying off or they are weak in that particular organ. Because stem cells in every individual organs have their own stem cells, right? It's like, okay, the heart will have their own stem cell, the kidney will have their own stem cells, the brain will have their own stem cells. Each individual organ in the body will have their own stem cells. So these particular organs, all of them will be stimulated by the photons that go into the cells to make them alive again, to reactivate the production of stem cells and get them to be more efficient. Okay, next slide, please. Yeah. What is a cell? Okay, a cell is basically the smallest part of a human being, right? A group of cells together will form a tissue. A group of tissue together will form an organ. Many organs together will form a body or organism. That's our human body. That's what a cell is all about. So in that cell, we have mitochondria, we have nucleus, we have other parts of the cells. But the most important part of the cell for its energy and its life is ATP, adenosine triphosphate. So the more ATP that you have in the cell will make your body more alive and younger in that aspect, right? Okay, next. So this adenosine triphosphate, we are selling a product that showing its efficacy in terms of its usefulness. So if you feel that it's a bit too much of a mouthful to pronounce adenosine triphosphate, then you just call it ATP, which is just energy cells for the energy for the cells. The more ATP you have in the cells, the more energetic your cells will become, and the more alive your body will become eventually. That is that simple, okay? Because when you start selling a product like this, you do not have to go into a very detailed, like some of them have asked me like how you produce ATP, what are the things that you need to do to get ATP. If you go to that level, that I got the specialist to ask me that, I says, whatever it is, theory is one part. Important is how effective it is to help you in your present condition. Okay, I'll lead you to that, no worry. So ATP is important. Just remember it as ATP, all right, if you cannot pronounce it. Now, this is to show you the live blood test. The one before is the normal one that most of us will have if you are, say, 35, 40 years old and above, right? Your cells are all agglutinated together at the bottom on the one before, right? So if you have all these agglutinated cells together, it's not going to be flowing easy in your blood vessel, as it can be shown on the left-hand side of the blood vessel. It will cause congestion. It's just like a highway. You all cars all group together and move together at the same time, you cause congestion, you cause traffic jam. When you cause traffic jam, what will happen? You get numbness of the extremities, you get pain in the joints, you get pains in the muscle, you get pain in the head, you get a heart attack, you get stroke. Why? Because there's no enough oxygen going to that particular site. Why you get pain? Why you get inflammation in your muscle, for example? Because there's no oxygen going through. There is not enough oxygen, so it's called ischemic condition. Means there's lack of oxygen in the muscle. So when there's lack of oxygen in the muscle, it causes inflammation and pain comes in. So the blood circulation is very important in that aspect. So when you use this IM laser after having your first blood test, and it shows that all your blood are accumulated together, after half an hour, on the top photograph, you will see your blood will be individualized. Every cell is split up individually. This, in fact, I seen it for the first time myself on the 2nd of October when I attended the first meeting and I did my live blood test for the first time. And I was very pleasantly surprised to see this because I'm one who's not very healthy at that point of time. I carries around with me 4 stents in my heart. Yeah, I'm diabetic, I'm hypertensive, and I have a lot of health problem because of my very active and very interesting and colorful lifestyle. I am a pharmacist and I do not really care so much about taking care of my health. I really enjoyed my life for the last 66 years of my life. So henceforth, I'm suffering a lot of problems. So when I see this, I feel fantastic because why? A person like me with cardiovascular problem, right? It's very important to make sure that the blood does not clot. That means to say the viscosity of the blood must be very thin to make sure that there is no clot which will cause me a heart attack, which will block the stent or the blood vessel that it cannot go through in my arteries in the heart. So, and that shows with this device, making my blood at that standard, it will make sure that there is no heart attack or stroke for me, which I'm very, very confident to use it after seeing it. So since that day, I've been using it for the last 6 months, and I can tell you for sure, I'm so much healthier person. And thank you very much to Ventros for bringing this device to me, especially to my upline who introduced this to me. And thank you, Mr. KG Lim, for bringing this product to us in Malaysia, right? So next. Yo. Hi. Can you hear? Yo. Next slide.
Yeah, can hear is the screen start.
Screen start, okay. So
Okay.
okay.
Got it.
Now, so what does this device does for you, right? Now, the low laser light therapy at 600 nanometer gives you more oxygen to your cells to be able to carry to the whole body, right? Apart from that, the increase in ATP in the blood that goes to all the cells in the body will revitalize all the cells in the body and in turns revitalize your whole body, all your organs and all your body. The whole body will be young again. Basically, that's it. To summarize it, your body will be young again. Like me, I think I have become much younger in terms of my capability as a person. Apart from my 66 years of age, I would think 6 months before and now, I'm so much healthier as a pharmacist, I can tell you for sure. I have almost the pain and aches in my osteoarthritis, my various other problems, my health condition, my diabetic, my hypertension has improved tremendously. Yeah. And apart from that, I think I look better. A few months ago and now just straight away tell me, hey Billy, you look good, you really look good. I say, yes, of course, I not only look good, I feel good, I feel very good. Yeah, that's what I am laser has done for me. So it regulates your BP because it brings down your BP in terms of the vasodilator effect of the nitric oxide that is excreted in your blood. So your blood vessel will expand and be softer, so your blood pressure will come down. So some of the people who came to me and says after using it, the blood pressure goes down too low, and they feel they are giddy or feel tired and lethargic because of too low a pressure. It can just do this kind of function. So if you have that, I would suggest you maybe take some ginseng supplement like Pharmaton or Hawthorn that will bring up your heart. This ginseng extract is actually cardiotonic effect. It means you make your heart stronger and pump stronger so that your blood pressure will come up a bit, so to regularize your blood not to be too low. But in fact, I am looking forward to a very fantastic product that is coming in from the company. There is a CV8. It is an abstract of stem cells from a 80 years old wild ginseng plant. In fact, to be very honest with you, I'm looking forward to take this for myself and to introduce it to all my friends to take it. Those who are interested to be to live a better, healthier life and a younger lifestyle, yeah, please follow me. take this one, okay, and use IM laser together. It will be a fantastic combination. A synergistic effect will come to you. Okay, the next one. Why this device is important? Because we are treating the blood. Now, so basically, back to the last one. The blood, we treat the blood because why? First thing, the blood do only two things. The blood takes nutrients to all parts of the body, right? That is what the blood does. The second thing, the blood detoxify the body. So basically, the blood only do two things in the body: nourish the body, detoxify the body. So it's a balance. So in order to do that, the blood circulation must be effective. It must be able to reach all the parts of the body, right? So if your blood vessel is constricted in certain parts of the body, bloods are not going through to that, then that particular organ will not be nourished and it will deteriorate in its function. So it removes toxicity and it restores cell functions, as you see. So it produces a lot of ATP. It makes you energize again and become young in terms of your quality of life. And as organism, as itself, as a human being, you will be energized and become young again, like me. Okay, next one, please. Now, how the IM laser works and why you should use it on the left hand. To about 1.5 inches from your wrist, the bend of the wrist, and then put the nasal line into your nasal. Is because can you see the other parts of the picture? Because in the nose there is a lot of capillaries flowing in the nose. There's a lot of blood in the nose, and the epithelial cells in the nose are very, very thin. So when you use the nasal probe in your nose, the laser light will penetrate all the blood vessel, and all the blood that is passing through will be stimulated and exposed to the photons of the laser cells, laser light. So all the cells, all the blood cells that pass through it, which is something like about 18 minutes, all your blood, the whole body pass through one session. Half an hour, you have 3 sessions of all the whole body blood will go through it. And they're all stimulated and producing ATP, nitric oxide, stem cells, ROS, all together. So you will feel fantastic after half an hour. That I can tell you honestly, it does for me. Just after half an hour, I can feel I totally different. I can feel that I feel more energetic. I am more alive. I'm my cognitive aspect. I mean, I can think faster. I can see better. I feel good. I feel really good. Just a half an hour session. So that's how it does. When you use it at the nose, you can see the laser light coming through your skin, shining onwards to the upper part of the nose. You see, all the blood are rushing to your head, straight off to your brain. So you stimulate the function of the brain very fast. That's why after using for half an hour, the brain cells will be activated. You feel very alert. You can feel that your eyes are even more brighter and more focused than before you use this product. And if you happen to have any facial problem like Bell's palsy, cerebral palsy on your face, or you get stroke where your muscles are weakened on one side, you will see that you will improve tremendously. Guys who have been having cerebral palsy and Bell's palsy for the last 3-4 years, a friend of mine who have been using for just about 3 weeks, is straightened out totally. People got stroke for years. Their mouth is slanting on one side. After using for within a week, they become straightened. That's a fantastic and marvelous improvement that I can see. And it's just not one. It's quite a lot of people who have stroke that I put on, and they have wonderful results coming out from them. They recovered so fast, right? And life is becoming more meaningful for them, right? Even one lady who has been bedridden for 4 years because of the stroke, after using it, she can walk. Yeah. So okay. Now, when you use this laser beam onto your pulse, there's the four on the right hand side, the 4 LED lights that are shining on the pulse. You will help to produce ATP and nitric oxide with the blood flowing through. And the one at the bottom of the 4, that one is pointing on a Nikon point, which is actually the center point of acupuncture. Now, this Nikon point stimulates 361 acupoints in the whole body. So if actually when you want to do acupuncture for the whole body, you probably got to stick 361 needles into each part of your body. That means from the the back to the front and everywhere, in your face and your nose and everywhere. You got to stick the needle. Can you imagine the trauma that you got to go through that? I think if you do it once, you'll never come back again. So in this aspect, you're using the Nikon point, you'll be able to stimulate and open up all the channels for the 361 acupoints in the whole body. So the chi will move through your body. So in terms of the Chinese philosophy of treatment, you need to have the chi flowing through your body to be healthy. Now, for this particular experience I had personally, I happen to be trying to promote this product to a friend of mine who's the Assistant Commissioner of Police in KL. In KL, I was there. So I called him on Sunday. He says, get out for lunch. So he says, okay, I'll be late. I'll be going for exercise and come and join you. So he came. I was with my wife. So he brought a gentleman along. So I asked him to try this device, my friend, the Assistant Commissioner of Police. So he says, no need to let me try. Let this friend might try. But he did not introduce his friend, like what is he doing and what is his profession and why he wants him to try. So I said, okay, let him try. Now I put the watch for him, I strap it up and all that. His name is Mr. Ng. So, and he just sat there quietly and I was talking to a friend, long old friend. Hey, where have you been? This and that kind of thing. Children, where and there. Within 5-10 minutes, this Mr. Ng turns to me and says, wow, hey, this device, what do you call this device? Oh, fantastic, man. I said, hey, why you say it's fantastic? Mr. Ng, why suddenly after about just 10 minutes you say it's fantastic? So he says, you want to know? I say, yeah, I of course I would like to know why you say it's fantastic. He said, I can feel the chi flowing around my whole body very fast. Oh, is it so? How come you can tell me that? I said, how come you can comprehend that? How can you can feel that? So then only my friend, the commissioner of police, my friend, Billy, is actually my Qigong master. This morning I went for the class with him. Oh, I see. He is a Qigong master. He has been practicing Qigong for the last 50 years. So of course, he knows what is Qi flowing around his body. People like me who will never practice Qigong would not know why I can feel the Qi flowing around the body. And for a Qigong master to be able to tell you in 10 minutes that the Qi is flowing around his whole body, that proves that this device is really fantastic. It's not just a hearsay. It's not just like, oh, this can do that, this can do this. No, it is actually doing it. And it's coming from somebody I don't know. Somebody I met for my first time in my life, and they can testify to that this is really a fantastic device. The chi is flowing around his whole body. So take it from me, if that guy can say that, the Qigong master, I can assure you it is truth. Right? Okay, next one. Apart from that, there are two magnets that are on top of the 4 lights of LED, one on the top, one at the bottom. Now, in order to prove that there are magnets there, you can always take a clip, a paper clip, and just put it on there. It will stick on, right? That shows magnetism is there. Now, this magnetism, actually, the effect is very good in the sense that it will split the cells to individual cells. Why it split the cell? It's very simple. The theory part of it, to me, as a pharmacist, is all the red blood cells contains iron molecules. All of them. Every individual cells contains iron molecule. That's why when you say the patient is anemic, that means not enough blood, that means it's not enough iron. So you got to feed in iron. Not the iron that they get from the hammer or from the nails. No. Biological iron, ferrous sulfate, ferrous hydroxide, that kind of thing. So you ferrous fumarate, you feed this patient ferrous fumarate, that kind of thing, to build up the iron in the blood and the body so that he will not be anemic, right? That's what it is called, lack of iron. It becomes quick care, you know. So when the magnet pass through these iron molecules, it will definitely magnetize the iron molecules in each individual cells into North Pole and South Pole. All of them, all of the cells will be North Pole and South Pole, the iron molecules. So we know in theory, North Pole repels, So when north and north come together, it will repel. South and south come together, it will repel. North and south together, it will come. They will attract each other. So when all these are all magnetized into north and south pole, it will repel each other when they move around the body. So that's why your blood split up. That's the reason why your blood split up. That's the reason. That's why your blood becomes less viscous. It can move easier, and then it can move around the body easier in that sense. So this is actually the function of how you use the IM laser on the left wrist, right? And strap it there, your Nikon point and your pulse there, where all the bloods are going through, and your nasal, where all the thin epithelial cells are all stimulated by the laser light. So this is the real function, how it works on you. So, and of course, there are people who says there are cardiologists who are not fully aware of the device. Will say those who have a cardiac pacer, those who are using defibrillator, do not use this product. Now, I can't blame them because they are not fully aware of the product as it is. Well, I'm sure of what I'm doing. So the radius of the radiation and the magnetism from this watch is not very far. It's something like about 4 to 5 inches away from the surrounding of the watch. So it's the radius is about 4 or 5 inches, put it 6 inches. So anything above 6 inches away from the watch, you are safe. That means to say, those who have cardiac pacer and cardiac defibrillator in their heart should not use this device too near to the heart. Put it away about 1 foot or 2 feet away, like when you wear the wrist is at least 3-4 feet away. So you are very, very safe. You don't have to worry. You don't put the watch next to your heart, okay? So you don't have to worry. If you have doubt and the cardiologist tell you so, ask him to call me. I talk to him, not the problem, okay? Because in my group, there are a lot of top cardiologists in the country, really top. Even the DG, the former DG, is a friend of mine, so it's not a problem. I can tell you that. We have discussed this point. It's okay. All right. So next one, please. So this is what it does. The magnetism, it helps to improve oxygenation of the body, faster and more efficient elimination of the toxin, helps to lower stabilize blood pressure, helps to prevent arteriosclerosis. That's what it does, right? So these are the biomagnetic therapy. That's how it helps you. And at the same time, it helps the athlete and people who do exercise to be more energetic. That's why it helps you. This is the function that it does, right? Okay, next, please. Okay. Okay. So, okay, it helps in arthritis, headache, shoulder. All these are through my personal experience over the 6 months that I use this product. I have promoted to at least 50 doctors who are my friends and who are all very experienced doctors who have 30-40 years of their clinical practice, right? They have bought from me and they use it, and they found it very effective in terms of especially, as I say, skeletal muscular problem. Means you have pain and aches in your muscle, inflammation, swelling. It is a fantastic device. The effect is almost immediate, like something like about 40 minutes you can see the swelling goes down, the pain from a level of 10 to go down to about 1 or 2. A friend of mine, the one who was talking to, the billionaire who had a bee sting about 3 days ago. He went to his durian plantation. He had a bee sting. He called me, Billy, what to do? So I says, okay, get your guy to take out the sting, and then apply a cream that I given him. Take 2 Panadol. Then you use this device, 4 bars, 40 minutes on the sting. Use it 2-3 sessions. And after that, he called me in the evening and says, okay, Billy, I want to tell you something. No swelling, no pain, but a bit of itchiness only. That is how effective the IM laser is. It already reduced the pain and the swelling, but the itch is still there because probably due to the sting, it is allergic. But I had given him antihistamine at the same time, so he will not have a anaphylactic shock. That means to say he get a severe allergic reaction to the bee sting, which can kill people who are allergic to it. That's called anaphylactic shock, right? Normal people who gets a bee sting will not die. They will just get a bit of pain and a swelling, that's it. But if you are allergic to the sting, you will die. Within maybe half an hour to an hour, you will die. The whole body will swell up and you cannot breathe, and you die, just die off like that, okay? So that is how important it is to treat the patient. So he's very happy. So, okay, now this to prove to you how safe this product is. Now, your Euro standard is a medical device. It's very hard to get this Euro standard under class 3R. The American patent numbers is there. This is the American product per se, actually. It's American product. It's a registered patent American. But just exactly like my iPhone, I'm using iPhone 10. It is an American product, but manufactured in China because of cost restriction, right? So if it's made in America, probably it will cost about $8,000 by now. You will be getting it at 2008. So the quality assurance certificate is there, ISO 13485, which is very difficult to get for any medical device in the country or in the world for that matter. So you have stringent tests of 10,000 hours with 650 nanometers light efficacy, practice certificate for good practice. Okay, this is to make sure the endorsement of the product that you're going to use, that is IM laser by Ventros, is very, very, very safe. There is no side effect of using it now or long after you have used it. Okay, so you use this device with a very peace at heart and a lot of confidence. Use it with a lot of commitment, right? That it will definitely help you in your health, and to make sure your friends that you introduce to will be able to benefit from this product. I am very confident. I can talk to anybody, right? Anybody in the world, I can talk to them. I'm very confident this product will help them in many, many ways. I can challenge anyone to talk to me, no problem. I can be that confident. Unless and until you're that confident that this product will be able to produce the result that it's supposed to produce, you will not be able to sell to the other party in front of you. So you must have the commitment in yourself to be able to prove to others that this is that effective. Okay, next one, please. Now, basically, this device is restore cell function, right? Cell growth, cell repair, and cell absorption. Increase metabolic activity. Now, to increase metabolic activity, that's why your diabetic patient who are using this device will improve in their diabetic control. That means their blood sugar will come down. Because of the increase of metabolic activity, the burning up of the sugar in the blood will increase. So the amount of sugar left in the blood when they detect with the glucometer will be less. So in terms of that, you will also prevent the organic deterioration of other organs in the body because of their diabetic condition. Means the eyes, the kidney, the brain, the heart, everything. If the side effect of diabetic is very bad, you can amputate the leg because of ischemic, no blood flowing there, no circulation. Your kidney will fail. You will get end-stage kidney dialysis at the end of the day because your kidney and nephropathy, you will die. Your muscles and your legs will not have any feeling because nephropathy, the nerves will die off. Your eyes will go blind because you get cataract, you get macular degeneration, you have retina degeneration, all kinds of things will come in. You will get dementia, you get Alzheimer because of diabetic, right? And you had cardiovascular problem, you got heart condition because of diabetic. So diabetic is just not so simple. It's just not, oh, I got TGO, I got diabetic, period. No worry, I control blood sugar, end of story. No. It affects your whole body, your nervous system, your muscle dystrophy happen, your eyes go blind, your heart stops, you get heart attack, you get stroke, your blood become thick, yeah. You get amputated, you get ED, right? You get all kinds of problems because your kidney fail, right? It's because of your diabetic. So because of the increased metabolic activities, at the same time, your production of insulin because of the laser will be able to stimulate and make the insulin that they produce by your pancreas will be more effective, in the sense it become more sensitive. So if, for example, the same 1 unit of insulin that you have now at the age of 60, 65 and you're diabetic, is because that particular 1 unit of insulin is not be able to break down sugar effectively, right? So that is what we call insensitivity of the insulin that causes type 2 diabetes, right? So with this sensitizing of the insulin excreted by the pancreas in your body will be able to break down sugar more efficiently. Henceforth, your control of diabetic will be more effective and more efficient, right? So next one will be the accelerated healing process. It's very simple. The acceleration of healing process is that simple. Like, for example, you have a cut. You have a cut. It takes time for the blood to rush to that place to heal that cut, right? So more and more cells will flow in there to heal the cut. Now, if your circulation is no good and the flow of the cells and the nutrition to that particular cut is slow, that means the healing process will be very slow. It's like building a house. You take your brick one day one. So when are you going to build the house? So if you take 1 lorry at a time, 10 lorries a day, you'll be able to build the house in 2 days. That's exactly what happened. So when the blood circulation improves because of the splitting of the cells in the individual cells and the acceleration of the flow of blood in the body, the circulation will improve. The nutrition to that site of wound will improve tremendously. Hence, the healing will improve. It's so simple as that. It's a very simple process. The faster the nutrition goes there, the faster the healing will come. So the anti-inflammatory action comes because of the laser light that acts on it. The cells normally, when they have inflammation of the body, is because of reaction of the body towards something that is hurting it, right? And which is causing a lot of inflammation. Now, if the body is healing, you reduce inflammation very fast. That's how it works. And then stimulation of nerve function is like, if it's very easy to see, like people who got Parkinsonism, people who got cerebral palsy, people who got Bell's palsy, people who got, for example, you got carpal tunnel disease, people who got trigger fingers, things like this. You can see the effect is very fast. Within half an hour of using the device, you can see certain improvement. But of course, it's not going to cure you immediately, right? It's not like you get Parkinson for 30 years and then suddenly after using half an hour, you become cured. No, but it will definitely help your condition gradually and start using it, because you can actually see the improvement in the condition within half an hour after using the device. It has been proven to me time and again to a few doctors who, because of the age, they had Parkinson. After using it straight away, they can see the result. And not a single word is said, just I buy this device, see, I buy this from you, straight off. No need to promote. Just let him try. You straight buy it off. I don't have to promote. I have friends like that who just write the check for me without asking. Right? It's all proven. They know me well, they trust me well. So okay, pain. Pain, of course, pain sensation is individual. Right? People who can stand very painful incidents, their pain resistant, their pain tolerance higher. Of course, they won't feel so much pain. But there are people who cannot stand pain. A slight pain, they'll start shouting, oh, very painful, actually. Now, so it's very individual. So the only way to identify the pain reduction is to ask the patient yourself. Ask the patient to tell you how they feel at a scale to 1 to 10. For example, you have osteoarthritis pain of the knee. Anybody above 50 years old and have been very active in their life will have knee problem, right? That's why nowadays you can see total knee replacement is like a trend. It's a fashion, like wearing an LV bag, going around telling people, this knee cost me 18,000, no? And then the other guy comes, you say, oh, you see, my knee is 25,000. Why? I got platinum one, huh? Oh, I see, like that. So it's a fashion. It's an LV bag and a Channel bag. You're trying to outdo each other, right? So if you have osteoarthritis, you use it 4 bars. 4 bars intensity, 40 minutes. You tie it at the spot of the knee. There are 2 dimples at the knee or at the back of the knee. You do it 1 session, 1 cycle, 40 minutes, 40 minutes, 40 minutes. I can tell you and I can assure you the pain reduction of the osteoarthritic pain easily 80%. I can bet with you. Yeah, unless the patient lies to you. Because why? I am one of the patients. I've been suffering from osteoarthritis for about 40 years. Yeah, I'm a pharmacist. I do not want to take medication because all medication got side effect. So I've been suffering quietly, right? But I use this device 3 sessions and it has taken off my pain almost completely. Almost, I would say more than 90%. That is how confident I am. So if people who got arthritic problem, I can assure you, please let them try. Without trying, they will never know. And if they try, they will buy. That's for sure. Okay, take it from me. Okay, next one, please. You, are you there?
Yeah, I'm trying.
Okay.
Somehow today the screen keep stuck. I don't know why.
Okay.
Okay.
I tried to rush through this thing. Okay. Now, as I says, we are talking in terms of a cellular level. That means this device treats your cells, every cells in the body, because it's a red blood cells and whatever cells that have in the body is circulated to all the parts in the body. There's no blood in the body that has no cells, right? Yeah. So it's the whole body that they're treating. So all the system will benefit. The nervous system, the immune system, the cardiology system, cardiovascular system, the detoxification system, your GI tract, your digestive, reproductive, or whatever. All the system in the body will benefit from this device, right? So when they say, oh, it restores the 8 major body system and 80 types of health disease, to me, I think it's an understatement, right? In the sense that 80 major system, fair enough, good. But 80 types of health issues, I would think more than that. Because why? There are a lot of things that are not specified in that particular book that they state this. For one, I'll tell you what a lot of things I have seen for myself. First one that I really surprised me is hyperhidrosis. Have you heard of hyperhidrosis? Hyperhidrosis, the excessive sweating of the sweat gland. People whose hands are very wet, right? You shake hands with them, it's like they just had the bath and came out, right? Or they forgot to wash, dry their hands and shook hands with you. This lady who bought this device from me, she asked me whether it can help the daughter who is a 21 years old university student in UKM. And she's having this problem of hyperhidrosis. In fact, when she grasps her hand, you can actually see the droplet of sweat dropping from her hand. That bad. So I said, to be very honest, because I'm a very honest man, I cannot lie to people things that I don't know. So I just tell her, sorry lah, I don't think so lah, because honestly, I have never read about this and I have no experience about this. But I don't think so. It can help lah. But since you're already buying the device for me and you have the device, let your daughter try it. So I say, okay, my daughter will be back in a few days' time for the seminar break. Say, okay, let her try. You know what happened? She came back for the holidays in the family in Kappa. That's about 40 kilometers away from Klang. Right? She came back for holidays. The mother asked her to try to use it. She used it for 3 days. Twice a day, nasal line, right? On the nose, on the left wrist, twice a day, 3 days. And what happened? Her hyperhidrosis totally dried up. Can you imagine that? I asked any doctor, can you do anything with it? None of them can answer me. Hyperhidrosis, as far as the medical science is concerned, you cannot do anything. You cannot do anything, period. You just say, some of them will say, oh, they will try to be a bit smart because they don't know the etiology of how it comes. When you do not know the etiology of the disease, you cannot cure it. It's just that simple. Simple explanation, etiology means you have a pain on a hand. Then I'll check why the pain comes from. So the pain comes from maybe a needle that's pricking on the hand. Then I know, then I remove the needle. That's etiology. The cause is the needle, so I take it off. That's it. But now you have a pain in the hand. I don't know what happened. I cannot see anything. So how to cure it? Well, I don't know what happened to your hand, but it's paining you. It can be a psychological thing, right? So most doctors will treat hyperhidrosis in terms of a psychological matter, psychological illness, in terms of stress, or maybe she's having the exam, she's finding difficulty in school, college work, is because of family stress, the pressure on them, and all that kind of thing. It's more psychological than physiological. So there is no cure. But I'm really surprised, and it's a fantastic surprise because it's a friend's daughter that she got cured after using just 3 days and 6 sessions of the iron laser. That's how fantastic this product is. And I can tell you, in that 80 types of health issues, it's not written there. You check, it's not there. You must add, there's another 81, right? So apart from that, tinnitus, of course, is written there. Tinnitus is another disease whereby the doctors could not do anything about it. It's ringing in the ear. It can even cause, it's very severe, it can cause vertigo. The guy can literally vomit and feel giddy and fall down, that kind of thing, vertigo, right? A lady who is a retired teacher of 62 years old has been suffering from tinnitus for 2.5 years. And she has been seeking treatment from Alostar right up to KL, up to University Hospital and back for the last 2.5 years. And nothing can be done. Nothing. Until she met me and she used this device. Actually, she bought this device for her husband, who is undergoing kidney dialysis. And after a few days, I went to the house and asked them, how is the husband improving with the device? And says the husband was there. The husband was telling me, I feel good. I don't feel so tired now after my dialysis, because he do dialysis alternate days, 4 hours, 3 times a day. And after each dialysis session of 4 hours, he just come home and rest and sleep and do nothing, very tired and exhausted. Now he don't feel so tired. He feel good. He can watch TV, read papers and all that. He is very thankful. But that was not what he told me. You know what he told me? Actually, the person is more happy. Is your friend? I say, why? Why you say it's my friend? Oh, you ask her lah. You ask her. So I asked her lah. I say, hey, what happened? Why your husband say you are much happier than him? You know, and you're supposed to be buying this device for him. Oh, he said, oh, actually, what happened? Really, I use it since I got the device. I use it. I got these tinnitus, so I use this device, the nasal line, as well as I put the nose probe, the laser probe into my ears. Now I use it for 3 sessions a day, 3 days, and to my surprise, it just disappeared. You know, the tinnitus just goes off. That's just it. 3 days. It's so marvelous as that. So that's why I say, have faith in this tiny little wonderful device. Do not belittle it. You know, a doctor, the first doctor that actually I promoted is a dato, a very experienced GP. He is 75 years old. He has been practicing for 48 years as a GP. Very experienced doctor. And he's very skeptical of this tiny device that I explained to him about the ATP lah, the nitrous oxide lah, the ROS lah, the stem cell production or whatever. And then with friends, I'm very, very frank to him. I say, hey, brother, irrespective of whatever theory lah, you and I know lah, no need to explain, right? What I'm sure you want to know is actually this thing can work or not. True or not? He said, yeah lah. But honestly, I don't believe you lah. He said, how can all this tiny thing can do so many wonders? So I said, okay, I lend it to you lah. The only thing I want you to do is to promise me that you use it every day without fail, right? Promise me to use it without fail at least twice a day, nasal line, that's it. That time I was not trying to tell him about spot treatment and all that. Just use it, and I want to find out. He's the first doctor I treated, I talked to. So been friends said, okay lah, I'll give you the try lah, see how it goes. You see? I said, okay. I left the whole set with him. The first day he went back to his house at night. He's staying in the golf course. So next day is his off day. He's playing golf in the morning. So can you imagine at night when he slept, he used the device once and then he slept. Next morning at 4 a.m. in the morning, he messaged me. Hey, Billy, I don't know whether it's due to this device or not. It's so fantastic. My backache is at least 80% gone. And then I slept very well. I feel wonderful. I feel very alert and very energetic. Can you imagine? First session. So I said, hey, brother, continue using lah, continue using. So after using 1 week, he start telling me another story. Hey, you know something? Now I don't feel tired anymore. And another thing, another week, oh, my BP came down. No, now I am no more taking medication for my BP, man. Oh, it's so fantastic. Then after another week, he call me, hey, my diabetes also came down. Huh? Now I'm literally not taking any diabetic pills. First time in my life, I am not taking diabetic pills. And that is coming from doctor. No? It's not any layman who doesn't know about their health and the condition. For his hypertension, no more medication. For his diabetic, no more medication. Then another one, which is a shocker to me. Hey, say one thing, my constipation, no problem at all. Now, hemorrhoids, my piles disappeared. Oh my God, that is wonderful news, man. Yeah. So that comes from a doctor. That was his personal experience. And since then, he's selling quite a lot now. He has committed to sell this product already because he has been proven to him personally that it's that good. Okay, thank you. I think that's it. I think I have to tell you about the iron laser. So from my personal experience and my personal advice, please use this device regularly and recommend to all your relatives and friends to help them in their health, right?